In this video, we will discuss about the most known points in clinical setting regarding menopause. First of all, according to the name suggesting, pause in the menstruation is known as menopause. Then for how many months it should be stopped, means it is the cessation of the mens for 12 months. Okay, usually after 45 years. Cessation of menstruation for 12 years, usually which is experienced after 45 years. Now, what will be the complaint of this patient? The most common complaint with menopausal women will be vasomotor complaint. Vasomotor complaint, that will be hot flushes and night sweat. And vaginal complaint will be vaginal dryness and dyspareunia, means painful coitus. These are the most common complaint of the menopausal women. Now, we should never be confused about the any investigation, means how to diagnose. To diagnose the case of it is usually done by clinical examination and the complaint and according to the age of the patient. But to confirm whether the patient is suffering from menopausal syndrome or any other underlying cause, we can confirm menopause by looking for FSH level, which is usually increased in case of menopausal women. Okay, we can look the FSH level, but we should not be confused with this point, that every woman should not undergo any clinical chemical investigation or hormonal लेवल का एग्जामिनेशन करना कोई ज़रूरी नहीं है मेनोपॉज के डायग्नोसिस के लिए. इट इज़ डायग्नोज्ड क्लिनिकली. Do not be confused, never be confused. It is a clinical diagnosis. Okay, now there are a few points in case of menopause. Okay, because we should always know that menopausal symptoms which we studied here, the complaint of the menopausal women usually resolves spontaneously within few years. Okay, so we should not undergo any they do not need any type of medication. But if the patient complains very severe symptoms, okay, then the most effective therapy will be, for treatment modality, it is usually hormone replacement therapy. Okay, it is HRT, and it is usually it should be prescribed. HRT is prescribed in case of the women who are less than 60 years, and the menopause is usually within 10 years of menopause. 10 years of menopause. Now, we should know that the contraceptive need must be addressed in perimenopausal period. Perimenopausal period is it is usually 5 years before and after the menopause. Perimenopausal में period needs contraception. Okay, then the other point will be usually in case of hormonal replacement, usually we prescribe oral contraceptive pills, means it in a combined form. Okay, progesterone and estrogen, but the transdermal form of the estrogen is more effective. Okay, transdermal transdermal estrogen is more effective in case of menopause as compared to oral estrogen. These all the symptoms which we are seeing, which we see in the menopause is due to low estrogen. So we are supplementing estrogen in different forms. It can be either transdermal or it can be oral form. So that if the duration of the, we should also know that the if we have prescribed this hormone replacement therapy for more than 5 years, if it is more than 5 years, then the patient have very high risk, they are highly prone to breast cancer. Okay, so very consciously we should prescribe HRT. breast cancer का chance बहुत ज़्यादा हो जाता है. Now the other point is the, in the absence of systemic estrogen therapy, genital symptoms, the genital symptoms which we studied as dryness and dyspareunia, genital symptoms के लिए we can prescribe them lubricants. Lubricants means vaginal lubricants can be used to relieve the dryness as well as dyspareunia. Lubricants can be used or topical estrogen can also be used. Topical estrogen. So these are the treatment for the to relieve the vaginal complaint in case of the menopause. Okay, now there is some of the non-hormonal options are also available to relieve the vasomotor complaint. As we saw that the vaginal complaint is treated by lubricant and topical estrogen, now it's the turn of the vasomotor complaint. It can be treated by antidepressant drug, like it can be either venlafaxine or paroxetine. Venlafaxine or paroxetine. Some of the physician also prescribe citalopram and gabapentin is also very effective in these cases. So what we studied, menopause, it's the pause in the it's the pause or cessation in the menstruation for about 12 months and usually seen after 45 years. Then we saw that they usually complain about vasomotor symptoms like hot flushes and night sweat, and with vaginal complaint like dryness in the vagina or dyspareunia. For the diagnosis, to confirm the diagnosis, we can look that the estrogen level is low whereas the FSH level is high. Okay, and we usually the patient of menopause do not require any medication because the symptoms usually regress after few years. But if the symptoms is very severe, then we can treat. And the most widely used treatment modality for this patient is hormone replacement therapy, and it is given usually in patient less than 60 years or within the 10 years of the menopause. Okay, now according to the complaint we can prescribe medication is done. If the patient is complaining about vaginal dryness and dyspareunia, we will go for lubricants, vaginal lubricants or topical estrogen. And if she complains about the vasomotor complaint like hot flushes and night sweat, we will go for the antidepressant drug like venlafaxine, paroxetine, citalopram or GABA agonist like gabapentin. Thank you.